The last thing in anticipatory guidance is the one that most of us know about is oral hygiene. And that's taking care of our teeth and our gums and all our oral tissues. One of the questions I get a lot is when do I start brushing my baby's teeth? And my answer is as soon as they have teeth. If they have teeth, then they can get a cavity. Now most don't until later, around 2 years of age. But if it's there, it can get a cavity. There's some other things that have to happen. They have a lot of the little sponges you can put on your finger, or you can use a washcloth. Those things are talked about, and those are fine. I prefer a size appropriate toothbrush, just because when I have a 6-month-old or an 8-month-old child, I can do that, and they never know anything different. The problem with starting with one thing and then switching down the road is some children resist change, and so that's a battle that I don't want to fight down the road. So I just start with a toothbrush. The next question is, when do I start flossing? And this is a big one, and this is where I see lots and lots of problems, lots and lots of cavities, is that you should start flossing your child's teeth when their teeth are touching. If they have a space between their teeth, a toothbrush will clean it. Or if you can see gum tissue between their teeth, a toothbrush will clean it. However, if you can't, especially in the posterior or the back teeth, where those teeth touch each other, food and drinks will get in between those teeth and a toothbrush won't. And once again, you leave food and stuff in between your teeth, the bugs that cause cavities are going to go in there and they're going to love it, and they're going to eat and they're going to secrete a lot of acid, and the acid's going to make your tooth start dissolving and you start getting a cavity. And so strongly recommend flossing as soon as teeth start touching. One other note on that is I always warn parents, especially with 2 or 3-year-olds that have spaces between their back teeth, and they get real comfortable just brushing and come in 6 months and it's a good report, there's no cavities, and then suddenly between 3 and 4, if you're not watching, those back teeth will scooch together because we have a permanent molar that's going to come in about 6 and it starts making things switch around. So really look in there. If you cannot see between the teeth, then they need to be flossed.